I'm Randy Golden from Medical Technologies of Georgia, and I'm here today to introduce you to our new MTG Instant Cath Coude Tip Intermittent Catheters. Our catheters have eyes that are highly polished to reduce potential for irritation, and all MTG products are 100% latex free. Coude is a French word that means bend or elbow. A Coude tip catheter has a slight bend near the tip. Coude tip catheters are normally prescribed if a patient has an enlarged prostate and the catheter tip is designed to get past that tight spot. Also, there's a potential for patients that have strictures to use Coude tip catheters. Sometimes what happens when the urethra gets scarred is we'll have some tight spots along the urethral passageway, and the catheter will need to wind its way through too. A straight tip catheter will sometimes buckle, where a Coude tip catheter will pass to the bladder. MTG catheters have a handy indicator knob located at the distal end. And when the indicator knob is facing up, the tip of the catheter is also facing up. Ask your doctor or nurse before you use Coude tip catheters to ensure that you always use them exactly as they direct you to. Now that we've shown you our Coude tip catheters, I'd now like to take us to the next part of the presentation and describe our closed system intermittent catheter and how this will actually help reduce your risk of recurrent urinary tract infections. MTG's closed systems are designed so that the user or caregiver never actually touch the catheter. The catheter resides within its sterile filled bag, and the catheter is pre-lubricated, so that step's been eliminated. The bag is going to serve two purposes. It's going to collect the fluid once the urine starts to flow, and again, it's also going to protect the sterility. We're going to manipulate the catheter through the bag, up through the urethra, up to the bladder, and then the urine's going to get trapped once the urine starts to flow in the sac itself. And all we're going to do here is we're going to advance the catheter about 1 to 2 inches at a time, just like this. See how I'm manipulating it here, and I'm going to show you a little more detail in a second with an anatomical model, but you get the idea. The catheter will pass from within its sterile field up to the bladder. We're going to get urine flow at some point. The urine's going to get trapped right in the sac. When we're done, we take the catheter out, measure and record, tear the bag, pour the urine off, and we're done. MTG closed system catheters are all equipped with an introducer tip, which I'll take the cap off and expose. This little tip, made of silicone, is actually a protector, if you will, a membrane to protect the catheter below from bacteria that are located within the distal urethra. Studies show that 90% of urethral bacteria right when you first go in, about the first ½ an inch. So if the catheter goes through this region unprotected, it can literally push those bacteria further into your body. They can gain a stronghold, grow back, and cause urinary tract infections. By virtue of this introducer tip, that catheter is never going to come in contact with 90% of the bacteria located within the distal urethra. We're going to advance the catheter through this tip, just like this, like we talked about a second ago, and the catheter is not going to come in contact with those bacteria. You're going to feed it about 1 to 1½ inches at a time. It's very important when removing the cap from Instant Cath or Instant Cath Coude that you gently pry the cap off the introducer tip in this manner, okay? And the reason we say to do that is you want to make sure that you always leave the introducer tip intact. You don't want to pull the cap straight away from the bag, because in some cases it can actually catch the introducer tip and pull the tip completely off. You want to make sure the tip is in place, as it is in this one on my left hand, versus the one on my right hand, which has the introducer tip completely removed. It's very important when removing the cap from Instant Cath or Instant Cath Coude that you gently pry the cap off the introducer tip in this manner, okay? And the reason we say to do that is you want to make sure that you always leave the introducer tip intact. You don't want to pull the cap straight away from the bag, because in some cases it can actually catch the introducer tip and pull the tip completely off. You want to make sure the tip is in place, as it is in this one on my left hand, versus the one on my right hand, which has the introducer tip completely removed. It's very important when removing the cap from Instant Cath or Instant Cath Coude that you gently pry the cap off the introducer tip in this manner, okay? And the reason we say to do that is you want to make sure that you always leave the introducer tip intact. You don't want to pull the cap straight away from the bag, because in some cases it can actually catch the introducer tip and pull the tip completely off. You want to make sure the tip is in place, as it is in this one on my left hand, versus the one on my right hand, which has the introducer tip completely removed. To illustrate this further, I would like to just show one time exactly how the introducer tip is going to look inside the anatomy when you get ready to catheterize. You're going to insert the catheter and the introducer tip into the urethra, just like so. So it's going to look just like this inside the body, and then we're just going to hold on to the catheter in the bag with one hand, and we're going to advance the catheter with the other, just like this. Okay, so finally, I'm going to bring the anatomical model down between my laps so that the users can actually see what they're going to be looking at when they catheterize themselves. First thing we're going to do is we're going to take the soap and water washcloth and we're going to clean the glands of the penis. Okay? Set that aside. And now I'm going to reach back for the catheter. I'm going to remove that blue cap, exposing the introducer tip. Okay? And now I'm going to cuff the penis with my left hand. I'm right-handed, so I'm going to advance the catheter with my right hand. I'm going to hold the penis with my left. I'm going to use the last 3 fingers to hold just below the glands, just like so. And if I had extra foreskin here, I would again pull the foreskin back using those same 3 fingers. Now, I'm going to insert the catheter and the introducer tip into the urethra just like this. And I'm going to use my thumb and my index finger to hold everything stable, so it should look just like this in your lap as it does in mine. Now, I'm going to go to the catheter and I'm going to hold the catheter about 2 inches below the blue pincer grip, and I'm going to start feeding the catheter in at 1 to 1.5 inches at a time. I fed it in. Now I'm going to squeeze with my left hand, and I can pull the bag back with my right. Grab the catheter again, release pressure with my left hand, advance the catheter with my right. Squeeze again with my left, straighten the bag back. Now that I've made 2 pushes, I need to go back and ensure that the indicator is facing up, and I can feel for the indicator within the bag, and I notice that it is facing up. I'm feeling for it right here, so we're good. And now I'm going to continue the process. Push, squeeze, pull, push, squeeze, pull, push, squeeze, pull, and urine will begin to flow. When we see urine flow, we give the catheter one more push to get the catheter right in the middle of the bladder, and we hold the bag down between the legs. When urine discontinues draining, pull the catheter out about 1 inch. Hold it right here. When we see no more urine flowing, pull the catheter completely out and go back and get our washcloth. And as the catheter leaves the body, use that washcloth to catch the eyes so you don't have any drippage. Now we're ready to drain the bag. So the last step is tearing the bag. There's a perforation mark where you want to start, so tear that across, and then just be careful to tear down into the bag, just like that. Turn the bag upside down, pour the urine off into the toilet. We appreciate your interest in MTG catheters. For more information, please visit our website, medtechga.com, where you can learn more about urinary tract infections, our complete line of closed system catheters, and request free samples.